Welcome to Module 1, Feeding Infants and Toddlers in Early Childhood Settings. This module focuses on promoting breastfeeding, family-style dining, and good nutrition for infants and toddlers in child care. The module is divided into two sections, Feeding Infants and Feeding Toddlers. You are presently in the Feeding Toddlers section, which will be about 1/2 hour in length. If you have not already done so, you will need to complete the Feeding Infant section at a later time to complete the entire module. The content of this module is based on the third edition of Caring for Our Children, which is the definitive source on best practice in health and safety in early care and education settings. Links to the standards used in the development of the content in this training session are available on the Nutrition module page of the Building a Healthy Start website at www.adph.org/healthystart. All of the Caring for Our Children standards are available online at www.nrckids.org. It is important to understand the difference between standards, guidelines, and regulations when discussing best practice in child care, and this knowledge will help you to better incorporate the information that you receive today into your daily practice. A standard is a statement that defines a goal of practice. It is usually based on scientific evidence. It is stronger than a recommendation or a guideline, but differs from a regulation because compliance is not necessarily required for legal operation. Examples of national standards include Caring for Our Children and the ASTM International Standards for Product Safety, such as their crib safety standards. A guideline is a statement of advice or instruction. A guideline is issued from an organization with acknowledged professional standing and usually comes from a perceived need for such guidance. One example of guidelines is the Choose My Plate campaign from the United States Department of Agriculture, also known as the USDA. A regulation, however, is a standard or guideline that becomes a requirement for legal operation. A regulation comes from an agency with governmental or official authority and is accompanied by enforcement activity. Examples of regulations include the Alabama Department of Human Resources licensing standards and the Health Department's food safety regulations. Because creating regulations is a lengthy legal process, regulations, although they still must be followed, may become outdated and no longer represent best practice. Please remember that the content of this module is based on the best practice standards published in Caring for Our Children. These standards may or may not have been adopted as regulations in Alabama. Caregivers should be familiar with state and local child care regulations and operate in compliance with such regulations. Before we begin talking about feeding toddlers, let's briefly review the importance of nutrition in early care. Food provides the energy and nutrients needed by infants and toddlers during this critical period of growth and development. As a caregiver, you need to provide food each day to meet each child's nutritional needs. The food you provide should be clean, safe, and developmentally appropriate, and it should look and taste good. For toddlers, it is also important that clean drinking water should be freely available throughout the day. As a caregiver, you have the opportunity to observe children's eating patterns in a relaxed and pleasant eating environment. You can then partner with parents to promote the development of healthy eating habits in their children. So let's begin learning about best practice related to feeding toddlers. Children should be offered nutritious meals and snacks each day based on the length of time they are in child care each day. If the child is in child care for 8 hours or less, serve at least 1 meal and 2 snacks, or 2 meals and 1 snack. If the child is in child care for over 8 hours, serve at least 2 meals and 2 snacks, or 1 meal and 3 snacks. If breakfast is not served by the child care program, then communicate with parents to be sure every child is offered breakfast. Toddlers need frequent small servings of foods, meals, and snacks to provide their total daily nutritional intake. They need to eat every 3 to 4 hours. The USDA requires 2.5 hours between meals. For example, between breakfast and lunch, and 1.5 hours between meals and snacks. For example, between lunch and an afternoon snack. Before you advance to the next slide, take a few minutes to review the handout, Child Care Meal Pattern for Toddlers. This handout is based on information from the USDA's Child and Adult Care Food Program and is consistent with Alabama's licensing standards for child care programs. We will be looking at the meal pattern for toddlers in depth in upcoming slides. Be sure to allow sufficient time, that is 20 to 30 minutes, for each child to eat. If a child does not complete his meal, he will probably be hungry and will eat when the next meal or snack is provided. Some children may be very slow eaters, and some children may be very fast eaters. It can disrupt the daily routine if one or two children finish their meals much sooner or later than the other children. If you are dealing with a slow eater, gently remind the child that you have 5 more minutes or give a similar reminder of time. After the 30 minutes, take the food away and involve the child in other classroom activities. If you are dealing with a fast eater, encourage all of the children to chew, taste, and enjoy the foods. Involve the children in pleasant mealtime conversation. However, if a child has completed his meal, it is not necessary for him to remain at the table. Meals and snacks should contain at least the minimum amount of foods shown in the meal and snack patterns for toddlers described in the Child and Adult Care Food Program Meal Service Requirements. In the Child and Adult Care Food Program, there are 3 components to a reimbursable breakfast. The first component is 1 serving of milk. Remember to give whole milk up to age 2 years and reduced fat milk after age 2 years. The second component is 1 serving of a fruit or vegetable. You may serve full-strength fruit juice, but remember that those 2 ounces count toward the recommended daily amount of 4 to 6 ounces of fruit juice for children 1 to 6 years of age as recommended by the American Academy of Pediatrics. You may choose to serve a sliced or diced fruit or vegetable or full-strength vegetable juice. The third component is 1 serving of a grain or bread. Bread and grains must be made from whole grain or enriched meal or flour. Cereal must be whole grain, enriched, or fortified. Permit 1 or more additional servings of nutritious foods as needed to meet caloric needs of individual children. There are 4 components for a reimbursable meal for lunch or supper. The first component is again 1 serving of milk. The second component is 2 servings of a fruit or vegetable. Again, if you serve full-strength fruit juice, remember that those 2 ounces count toward the recommended daily amount of 4 to 6 ounces of fruit juice, as recommended by the American Academy of Pediatrics. You may choose to serve 2 servings of a sliced or diced fruit or vegetable or full-strength vegetable juice. The third component is 1 serving of a grain or bread, which must be made from whole grain or enriched meal or flour. The final component of lunch or supper is 1 serving of a meat or meat alternative, which includes meat, poultry, fish, cheese, eggs, cooked dry beans or peas, peanut or other nut or seed butters, or yogurt. Many child care programs do not serve peanut butter due to the prevalence of peanut allergies. Again, permit 1 or more additional servings of nutritious foods as needed to meet caloric needs of individual children. While a ½ ounce of nuts and seeds may be used during lunch and supper as a meat alternative in the Child and Adult Food Care Program, nuts may only be served to preschoolers aged 4 or more years in licensed child care centers and homes in Alabama. Seeds, which may cause choking, are only to be served under close supervision and must be prepared appropriately for the age and ability of each child. For snacks, select 2 of the 4 following components. The toddler can be served 1/2 cup serving of milk or 1/2 cup serving of a fruit or vegetable, which again includes full-strength juice. Note, however, that the serving size of the fruit or vegetable is larger for a snack than for a meal. The third option is a 1/4 cup serving of grain or a half slice of bread. The fourth option is 1 serving of a meat or meat alternative, which includes the same types of food as in lunch or supper, but in a smaller serving size. The only exception to the smaller size is for the egg, which remains the same. Again, while a ½ ounce of nuts and seeds may be used as a meat alternative for a snack in the Child and Adult Food Care Program, nuts may only be served to preschoolers aged 4 or more years in a licensed child care program in Alabama. As you will remember from the feeding infants section, cow's milk should not be given to infants under 1 year of age. There are 2 things to remember regarding toddlers and cow's milk. Toddlers between the ages of 12 to 24 months may have whole pasteurized milk. Children over 2 years of age should be served reduced-fat pasteurized milk. Toddlers need the calories from the whole milk and other fats they ingest. These calories provide the energy needed for their fast rate of development. After age 2, it is appropriate for children to begin to eat fewer high-fat foods. Parents and caregivers should follow the recommendations of the child's regular doctor regarding use of 2%, 1%, or skim milk. Also, if signs of milk allergy or lactose intolerance are noticed, the child's regular doctor may recommend other milks such as soy or almond milk. To serve the healthiest meals and snacks, choose foods that are lower in fat, sugar, and sodium. Remember that infants and toddlers need some fat in their diet. Fat is essential for development, including brain development. To reduce sodium intake, do not add salt when cooking and remove the salt shaker from the table. Limit foods that are high in salt and low in nutrients, such as potato chips and some crackers. Also limit high sugar and low nutrient foods, such as cookies, candy, and cake. To reduce the amount of sugar that children consume, limit sweetened beverages. Offer water, milk, or juice instead. Remember that fruit drinks that contain 10% juice or less are really just sugar-sweetened beverages, and water, milk, and juice are far better choices nutritionally. Let's review some of the basic premises for healthy eating. First, practice portion control. Enjoy your food, but eat less. Second, eat a variety of foods. Foods can vary in many ways. There are different food groups such as dairy, protein, fruits, vegetables, and grains. Foods can have different colors such as red apples, green pears, orange carrots, and yellow squash. Foods can have different textures. Think of the difference between white and wheat bread, cooked and raw vegetables, a soft banana, or crisp celery. Foods can vary by shape, such as a long zucchini, a round biscuit, sliced bread, or a grated carrot. Foods can vary by method of preparation. Foods can be steamed, grilled, fried, baked, or raw. Foods can have different temperatures, such as cold milk or warm bread. And last of all, foods come in different sizes. Think of the difference between a blueberry, a kiwi, and a large banana. The third premise for healthy eating is to choose to eat and drink healthy and nutrient-dense foods and beverages. Healthy foods are those that supply a significant amount of nutrients, including vitamins and minerals, as well as energy in amounts appropriate to meet children's growth and development. To prepare a healthy plate, make half of it colorful fruits and vegetables. Make the other half of the plate grains and proteins, especially emphasizing whole grains and lean protein. Remember to choose reduced fat milk for children over 2 years of age and foods that are lower in salt. To avoid unnecessary sugar consumption, drink water instead of sweetened drinks. Both commercially prepared foods and foods prepared on site should meet safety, sanitation, and nutritional values in accordance with the program's written policy and in accordance with applicable standards and guidelines, such as DHR's minimum licensing standards, the USDA's Child and Adult Care Food Program, and the Health Department's food safety regulations. Foods brought from home should also meet the nutritional and food safety requirements of the program's written policy. Foods from home must be clearly labeled with the child's full name, the date, and the type of food. Additionally, foods brought from home should not be shared with other children and should adhere to the program policy, including food restrictions such as a peanut-safe environment. Caregivers should have food available to supplement a child's food brought from home if the food is deficient in meeting the child's nutrient requirements. Young toddlers are beginning to develop self-feeding skills. At first, toddlers may sit in high chairs as the caregiver helps them learn to feed themselves. Caregivers should be seated within arm's reach of each child. As toddlers develop gross motor control, they will be more able to sit and eat at a table with other children. Once they reach this stage, child-sized table and chairs should be provided. If children seem to slip in chairs, it may help to place rubber matting in the chair seat. Rubber matting may also help keep plates and bowls from slipping on the table. Start self-feeding with finger foods and foods that stick to the spoon. Help the children learn to use eating utensils by supplying appropriate utensils, including a child-sized spoon, which has a short handle with a shallow bowl like a soup spoon, and a child-sized fork which has short, blunt tines and a broad handle similar to a salad fork. Mealtime would be messy as toddlers develop self-feeding skills. Encourage children through positive verbal and nonverbal cues. Be sure to smile. Family style is defined as adults and children eating together, sharing the same menu, and talking together in an informal way. Family style dining promotes decision-making, self-help skills, and sharing and social skills. There are many ways to integrate family style dining in child care. The most important aspect is that children and adults sit together at the table. Be sure to provide child-sized tables and chairs so that the children are seated comfortably. Often in food service, family-style dining means that serving bowls are on the table and passed around. If your program has concerns about the safety or practicality of passing serving dishes, particularly hot foods with toddlers, you don't have to pass serving dishes to implement a family-style approach. Instead, concentrate on helping the toddlers develop self-feeding skills. Begin with finger foods and progress to use of age-appropriate utensils. Offer appropriate portions at least 2 times. Model and begin development of table manners, such as please and thank you when asking for more milk or food. Encourage conversation on topics that children enjoy. Allow children who finish eating early to spend time in a learning center or other quiet activity in a supervised area. As with all meal service, remember sanitation. Wash and sanitize tables before and after eating, and wash hands before and after eating. Before you advance to the next slide, take a few minutes to review the handout, set the table for success, integrating family-style dining into child care. This handout provides many suggestions on how to integrate family-style dining into your program. As a caregiver, you may incorporate some of these approaches or all of them as you help the children learn that eating is a social experience. To help toddlers develop self-feeding skills, use small plates, small cups, and child-sized utensils. Rubber matting on the table keeps bowls and plates from slipping. Use silverware and institutional dishware as best practice. Plastic or melamine dishes that can be adequately sanitized are recommended. Do not use foam cups and flimsy plastic utensils. Children can bite off pieces of foam cups and break plastic forks and spoons. These broken pieces can cause choking. Also, do not use dishes and cups with chips or cracks. Avoid handmade dishes or pottery from outside the United States that may contain lead. Choose easy-to-grip serving utensils that offer appropriate portions. Encourage children to help with table settings. Children can also help with cleanup by disposing of trash. Caregivers should provide nutritious, appetizing food in an appropriate setting and then allow children to decide how much they eat at each meal or snack. Help children begin to learn their hunger and fullness cues. Encourage them to eat when hungry and stop when full. This awareness, sometimes called tummy talk, promotes healthy eating decisions that last throughout life. Toddlers' eating habits are unpredictable. Observe their eating habits week by week rather than day by day. If offered nutritious and appetizing foods, most children will meet their nutritional needs and grow adequately. Toddlers are often resistant to trying new foods. Encourage but do not force children to taste foods or to put foods on their plates. Many attempts, perhaps as many as 15, may be necessary before a child decides to taste the food or decides if he likes or dislikes it. To promote healthy eating, serve all foods and beverages at one time. Be sure to serve a variety of nutritious foods prepared in appetizing ways. Ideally, include at least one food each child likes as part of a meal. Offer each food to each child at least 2 times during the meal. Encourage the child to put food on the plate even if he does not taste the food. If children are allowed to make choices, they will likely eat more. Help children learn to take small servings. Allow a second serving if a child is still hungry. Prepare food in different ways. Vegetables can be eaten cooked, raw, or with or without cheese, in a casserole or in a salad. Fruits may be raw, sliced or whole, cooked, added to other foods, or in salad. Present new foods when the child is most hungry, or offer new foods as part of an activity. Never use food as reward for good behavior, or withhold food as punishment for misbehavior. Encourage children to eat or try foods, but never force them to eat a particular food. Offer all foods at one time, including fruits. Do not identify some foods as dessert foods. Be sure not to delay a child's snack or meal based on completing tasks. Give all children the opportunity to participate in all food-related activities. Toddlers may be at greater risk for choking because they do not chew long enough and may not have enough back teeth to grind foods. Toddlers may try to swallow too much food at one time and may have difficulty swallowing liquids and solids together. Allowing too much activity during eating can also increase the risk for choking. Food preparation, such as cutting or shredding, can reduce the risk of choking. Food pieces for toddlers should be 1/2 inch or smaller in size. Additionally, make sure that children are seated when eating and that they are supervised at all times while they are eating. A variety of different types of foods can be choking hazards for toddlers. Foods that are round, such as hot dogs, meat sticks, hard candies, and grapes, can be hazardous. Foods that are hard, such as nuts and raw vegetables, can cause choking. Tough foods, such as chunks of meat, can be choking hazards. As well, sticky foods, such as a spoonful of peanut butter or other nut butter, marshmallows, or a clump of raisins may cause choking. Dry foods, such as popcorn or pretzels, and slippery items such as ice cubes can be equally hazardous. Always be careful with non-edible parts of food, particularly fish with bones or fruits with pits. Encourage children to drink water throughout the day, especially during warm weather or when actively playing. Offer a small cup of water in addition to milk to drink with meals. Have a small pitcher of water available for children to pour themselves. Cold water may be served with or without ice. To give it some flavor for children who are accustomed to sweetened beverages, add ice cubes flavored with small amounts of juice or squeeze in a little lime or lemon juice or add a sprig of mint. Dietary modifications may be needed to promote an individual child's health. Modifications may include avoidance of specific foods or ingredients due to allergy, increased or decreased caloric intake, food preparation methods, or use of adaptive feeding utensils. If possible, child care programs should accommodate documented medically required dietary modifications. Several diseases and conditions, such as food allergy, inability to digest certain foods, need for extra calories, need for special positioning while eating, diabetes, celiac disease, and PKU may require dietary modification. Be sure to clearly identify and document required dietary modifications. Make sure that all of the child's caregivers are familiar with the child's dietary needs. Parents should provide a written history that contains any special nutrition or feeding needs for the child. Discuss this history with the child's parent and clarify how child care program feeding routines may differ from home feeding routines. Obtain written documentation and instruction from the child's regular doctor for dietary modifications. Documentation should include the following: the child's full name and date of instructions, the child's special needs, any dietary restrictions based on the special needs, any special feeding or eating utensils, any foods to be omitted from the diet and any foods to be substituted, any limitations of life activities, and what, if anything, needs to be done if the child is exposed to restricted foods. As needed, individual feeding plans and program menus related to special nutritional needs may be developed in consultation with the child's parent, the regular doctor, a nutritionist or registered dietitian, and other professionals such as nurses and speech or occupational therapists. A child may have an adverse reaction to a food due to food allergy or an inability to digest or tolerate certain foods. Most adverse reactions to food are caused by 8 food items: peanuts, tree nuts, shellfish, fish, eggs, milk, soy, and wheat. If a child can potentially have a severe allergic reaction called anaphylaxis to a food ingredient, then caregivers may attempt to eliminate that food from the program and facility. For example, some children have severe peanut allergies, so the program may attempt to create a peanut-safe environment. The term peanut-safe is more appropriate than peanut-free because it may be impossible to totally eliminate all traces of a particular food. Food residue may enter the environment from outside food sources, such as what another child had for breakfast or foods brought from home. There can be many different signs of food sensitivity. There may be itching, tearing, or redness of the eyes and swelling of the eyelids. The child may have sneezing, a running nose, nasal congestion, and nasal itching. You may notice mouth skin redness and itching or red bumps or hives anywhere on the body. Food sensitivity can also cause gastrointestinal or GI symptoms such as abdominal pain, nausea, vomiting, and diarrhea. Headaches, lightheadedness, inappropriate behavior, inattention, and mood swings can also be caused by food sensitivity. Caregivers must be trained in procedures to follow if a child is exposed to a food trigger. Children with a history of anaphylaxis or severe allergy may have been prescribed epinephrine. Caregivers are not required to accommodate dietary modifications based on personal preference. However, caregivers may accommodate dietary modifications based on specific cultural and religious preferences. Modification may involve restriction of certain foods at all times, such as a vegetarian or kosher diet, or a parent may request food restrictions only on specific days or during religious or other events during the year, such as Lent. Dietary modifications must still meet the child's daily nutritional needs. Ask the parent for written information about specific dietary modifications and discuss whether the requests can be accommodated. Toddlers with special health care needs may have individual requirements related to diet and swallowing. Food, eating style, food utensils, and equipment, including furniture, may have to be adapted to meet the developmental and physical needs of individual children. These situations require individual planning prior to the child's entry into the program. Caregivers must be trained in procedures to follow if a child has an emergency such as choking. Remember, promoting healthy eating in early childhood forms the basis for a lifetime of healthy eating. Before you advance to the next slide, take a few minutes to review the handout, Additional Resources for Feeding Infants and Toddlers in Early Childhood Settings. This handout provides federal resources that are excellent sources for more information about feeding infants and toddlers. Thank you for your participation in this training session. In order to finish Module 1, be sure to complete the first session on feeding infants. The training module team may follow up with you in 3 months to see how you have used this information. A short post-training survey may be sent to you at the email address you provided during registration.